1. Ischemic stroke. Initial management. A 72-year-old man with a history of hypertension and diabetes presents with right-sided weakness and slurred speech for the past 2 hours. His BP is 170 to 100 mmHg, and a non-contrast CT scan shows no hemorrhage. What is the next step? A. Administer aspirin. B. Administer IV alteplase, TPA. C. Start heparin drip. D. Control BP to 140/90 before treatment. Answer B. Administer IV alteplase. T-explanation. TPA is given within 4.5 hours of stroke onset if no contraindications. BP is only treated if 185/110. Hemorrhagic stroke, best management. A 65-year-old woman with a history of uncontrolled hypertension presents with sudden onset headache, nausea, and left-sided weakness. CT shows an intracerebral hemorrhage. What is the best initial management? A. IV labetalol to reduce BP 140 mmHg. B. Administer IV alteplase, TPA. C. Immediate neurosurgical intervention. D. Administer aspirin and heparin. Answer A. IV labetalol to reduce BP 140/90 explanation. Hypertensive hemorrhagic stroke requires BP control, target 140/90, and neurosurgery if needed. TPA and anticoagulants are contraindicated. Transient ischemic attack, TIA. Secondary prevention. A 58-year-old man had a 30-minute episode of right arm weakness and slurred speech, which fully resolved. CT scan is normal. What is the best next step? A. Prescribe aspirin and statin. B. Start IV heparin. C. Schedule carotid endarterectomy. D. Reassurance and follow-up in 6 months. Answer. A. Prescribe aspirin and statin. Explanation. TIAs are managed with antiplatelets, aspirin, statins, and risk factor control to prevent stroke. 4. Stroke mimic. Hypoglycemia. A 67-year-old diabetic woman presents with left-sided weakness and confusion. CT scan shows no acute infarct. Her glucose level is 40 milligrams per deciliter. What is the best management? A. Administer IV dextrose. B. Give alteplase, TPA. C. Start aspirin and clopidogrel. D. Admit for stroke workup. Answer. Administer IV dextrose. Explanation. Hypoglycemia can mimic stroke. Symptoms resolve with glucose correction. Epilepsy and seizure disorders. 5. Generalized tonic-clonic seizure, first-line treatment. A 25-year-old man has a first-time generalized tonic-clonic seizure lasting 2 minutes. He is postictal but returns to baseline. EEG is normal. What is the best next step? A. Start levetiracetam. B. No treatment needed. C. Order MRI brain and EEG. D. Prescribe diazepam for home use. Answer. C. Order MRI brain. Explanation. First-time seizures require an EEG and MRI to rule out structural or epileptic causes. 6. Status epilepticus, urgent treatment. A 40-year-old woman with epilepsy has been seizing for 8 minutes. What is the best immediate treatment? A. IV lorazepam. B. IV phenytoin. C. Oral levetiracetam. Wait and observe. Answer A. IV lorazepam. Explanation. Benzodiazepines, IV lorazepam, are first line for status epilepticus. If seizures persist, IV phenytoin is given next. 7. Absent seizures, drug of choice. A 7-year-old girl has brief staring episodes lasting 10 seconds, often during school. EEG shows 3 Hz spike in wave discharges. What is the best treatment? A. Levetiracetam. B. Phenytoin. C. Ethosuximide. D. Diazepam. Answer C. Ethosuxim. Explanation. Ethosuximide is the first-line treatment for absent seizures. 3 Hz spike in wave pattern. Movement disorders. 8. Parkinson's disease. First-line treatment. A 68-year-old man presents with resting tremor, bradykinesia, and shuffling gait. What is the best initial treatment? A. Levodopa carbidopa. B. Propranolol. C. Amantadine. D. Beta blockers. Answer A. Levodopa carbidopa. Explanation. Levodopa is first line for Parkinson's disease. 9. Essential tremor. Best treatment. A 55-year-old woman has a bilateral hand tremor that worsens with movement and improves with alcohol. What is the best treatment? A. Levodopa. B. Propranolol. Carbamazepine. D. Diazepam. Answer. B. Propranolol. Explanation. Essential tremor is treated with propranolol or primidone. 10. Huntington's disease. Genetic basis. A 40-year-old man presents with involuntary movements, personality changes, and family history of similar symptoms. What is the genetic mutation? A. CAG trinucleotide repeat expansion, B. deletion of dystrophin gene, C. tau protein accumulation, D. alpha-synuclein mutation. Answer: A. CAG trinucleotide repeat expansion. Explanation: Huntington's disease is caused by a CAG repeat expansion in the HTT gene. 11. Wilson's disease diagnostic test. A 19-year-old man with tremors, psychiatric symptoms, and liver dysfunction is suspected of having Wilson's disease. What is the best diagnostic test? A. Serum ceruloplasmin. B. C. Dystrophin gene analysis. D. CT brain. Answer: A. Serum ceruloplasmin. Explanation: Wilson's disease is diagnosed with low ceruloplasmin and elevated urine copper. 12. Multiple sclerosis. First-line treatment. A 28-year-old woman presents with optic neuritis and numbness. MRI shows white matter lesions. What is the best acute treatment? A. IV methylprednisolone. B. Oral prednisone. C. IV immunoglobulin. D. No treatment needed. Answer: A. IV methylprednisolone. Explanation: MS relapses are treated with IV steroids.